there. Hello there. You're very small, aren't you? You're a very small person, a tiny little person. In fact, I don't think I've ever had anyone quite so tiny as you in my doctor's office. Sorry, I don't mean to be rude. My name is Dr. Jones. Very nice to meet you. I believe you're here today for a cranial nerve exam, isn't that correct? Yes. And it's not just me who's going to be performing your appointment today. It's also going to be Dr. Sheik. That's correct. You're going to get 2 doctors for your 1 cranial nerve exam appointment today. Very exciting. And Dr. Sheik, perhaps you've already heard of her. Sometimes she goes by Miss Sheik ASMR. Absolutely wonderful person. Very talented as well, in a wide array of different things. So you're in for a treat today. Today's exam should be very good. I'm very sorry, do you mind if I pick you up and put you on the table? It's a bit difficult for me to bend over and perform the exam on you like this. I'm a bit old. I'm 30 years old now. My knees are starting to hurt. Okay, I'm just going to pick you up then, if that's okay. I'm just going to pick you up. Okay, there we go. Is that okay? There we go. That's a lot better now, isn't it? Now we're basically at eye level, and I can perform the cranial nerve exam on you nice and easily. Okay, so before we get started today, I need to ask you a few questions, if I may. It's only a short number. It won't take long at all. And then I'm going to hand you over to Dr. Sheik for the first part of the actual examination. She'll do a few tests on you, and then I'll step in and do a few tests as well, and we'll discuss amongst ourselves at the end the results of your cranial nerve exam, okay? But before all that, just a few questions. So, question number 1. When was your last doctor's appointment? Okay, very good. And what was that doctor's appointment for? Did they give you a prescription for that or any treatment? Okay, very good. Let me just have a quick look for my next question for you. Have you had any head injuries in the last 6 months? That can include just bumping your head as well, maybe as you're working or cleaning, anything like that. Okay, interesting. That's useful information. Are you taking any medication right now? Any recreational drugs? Sorry, I'm not gonna tell the police on you. Tell me. Okay, very good. Next question for you. Do you have any allergies that I should know about? Are you allergic to latex in particular? Okay, that's great. That's very good. Next question for you. Have you noticed any changes to your eyesight recently? Okay. And what about your hearing? Any changes in your hearing recently? Okay, very good. Only a couple more questions now. Actually, that was the last one, but I do have one question that I would like to ask you personally. Why are you so small? Why are you such a tiny little individual? That's I mean, I've just never encountered someone so small before. Is that offensive? I shouldn't be asking that, should I? Sorry, I'm very sorry. I'm not very good at being politically correct. Politically correct, you know what I mean? I'm a little bit of an insensitive idiot sometimes, but I don't mean to be rude. My apologies. It's just interesting. Very tiny little person. Interesting. Okay, that's enough of me rambling. I've collected the information that I need to collect. I'm going to pass this over now to Dr. Sheik, and she's going to do a few tests on you. Okay. See you in a minute.
Quite a tiny patient. Fascinating. Oh wow, you really are tiny indeed. You're really small. Really small. Out of curiosity, how big are you? Or should I say, how small are you? Okay, let me just do some measurements then. I believe that the cranial nerve exam tests might not work with someone quite so tiny. So I'll just do some quick measurements then. Quick measurements. Fascinating. Okay, so I'm going to start off with some olfactory tests, I think. Those would be quite simple, just while I think of some good tests to do for someone your size. Okay, so we're going to test your sense of smell now. So I've got here some aromatherapy oils, and I just want you to tell me what they smell like, okay? They will smell like something that you might smell every day. So just tell me what you can smell, Okay, so what is this? Rose. Good. What was that? You knew exactly what it is because you could read the bottle. Smell the rose. Okay. So I might need to do a test then and hide the bottle from you so you can't see what I'm opening. Okay, you're a very sneaky one, aren't you? Let's see. Cover it well. Tell me what you can smell. What can you smell? Smells sweet, yes. Cinnamon. No, it's not cinnamon, it's actually vanilla bean. Okay, one last one. Let me just open it and away from you so you can't really see what I'm opening. Okay, what does this smell like? Mint. It's not mint actually, it's eucalyptus. What was that? Good. Okay, at least you heard that sound. So you knew what that was too because you could feel the air on your face. Okay, let me see. So far you didn't do too well on the olfactory, the smell tests, and you haven't done so well on the hearing yet either. Okay, let me see. I'm just going to whisper some words, and I want you to tell me what I'm whispering. Biscuit. Good. Chocolate. Good. Glitter. Good. Coconut. Good. What was that tiny one? It sounded like I was shouting, did it? Okay, well, how about this then? I'll repeat. No. And this one. No. Oh, you got that one, did you? You read my lips. Okay. I'm not too sure how to evaluate your tests then, because it seems like you have cheated in some of them. You have cheated in some of them. So I'm not too sure what to say here. So I'll just make a note on here to say to Dr. Jones that you want trouble and that he needs to modify his tests a little bit for a tiny patient like you. So I might see you in a moment if something goes wrong, but Dr. Jones will see you and do some further tests now. Bye for now, darling.
Hello again, it's me, Dr. Jones. Good to see you, good to see you. I know it hasn't been very long. Hopefully you enjoyed your time with Dr. Sheik. Yes, she's an excellent doctor. Very good indeed. Okay, so now I have a few more tests that I need to do with you. Before we do anything, I'm going to pop on some latex gloves, okay? Just in case I do need to touch you for whatever reason, I will let you know when I need to touch you, if I need to touch you, okay? So obviously this is just for hygiene purposes and to keep everything to a professional standard. Oh goodness me, I've just ripped my glove. How that's terrible, isn't it? Let's see, I'm gonna have to go and find another one. My apologies. Let's see if I can get this one on without breaking it like an imbecile. So I'm an imbecile, aren't I? Terrible. There we go. That's a lot better, isn't it now? Hands nice and covered in my little latex gloves. Very good, very good. Okay, we're ready to begin now. What's the first thing I need to do? I think I need to take a look at your eyes first of all, just a general look. Obviously because you're so tiny, I'm going to use this magnifying glass to try and help me to see your eyes, okay? Let me just get a good look at that eyeball of yours. I'm going to look at one eye at a time, okay? Let's have a quick look here. Look. Oh, very interesting indeed. Oh goodness, that is interesting. Unusual eyes you have as well. Your entire physiognomy, is that what it's called? Physiognomy is a bit unusual, a bit different to what I'm used to. But we'll do a good cranial nerve exam test on you today regardless. No problem there. Okay, I'm just going to quickly take a look at your other eye now, if I may. This one's a bit trickier to see for some reason. Do you have lopsided eyes, perhaps? Lopsided eyes? Is on to something a little bit more productive, hopefully. I have an eye chart here, very nice eye chart. Let me just grab my pen actually, so I have a pointer. Okay, I just click that on there. Let me just see if I can line this up nicely for you. Very good, okay, so can you please tell me what is that letter? Okay, that letter. Good. That letter. Good. 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 Okay, very good. I'm surprised that you're able to see the letters on the last line. That's usually too small for anybody to see. These letters appear giant to you because you're so tiny. I see. So this whole eye chart segment was a waste of time, is that what you're telling me? Okay, that would make sense, actually, because I suppose you're about the size of one of these small letters, aren't you? So it would appear to be absolutely gigantic to you. Well, that was another waste of time, wasn't it? Another waste of time. Just quickly though, before we put away the eye chart, can you tell me what colour this is? Red. Very good. And what about this colour here? Green. Very good. Okay. Well, at least we know for certain that you can see colour. That's something, I suppose. Right. What tests can I actually perform on you with good accuracy, considering that you're so tiny? Let me just have a little bit of a think. Perhaps we'll do a light trigger test. Okay. I think it should work in the same manner. It doesn't really matter what size you are. So I'm going to be using this warm yellow light to begin with. What I want you to do is to keep your head still, and I want you to follow the light as it moves using only your eyes. Okay, so your eyes should be moving like this somewhat and tracking the light as it moves. Okay, so just keep focused on the light. Keep your eyes focused on the light for me as it moves. Okay, we're going to be taking it in various different directions. My apologies if it gets a bit bright, but obviously that is part of the examination, so please just suck it up, basically. It's important that we do this. Don't whine and complain and moan, because that just makes my job more difficult, doesn't it? And I'm just doing my job after all. As a doctor, I'm trying to take care of you and to assess whether or not your health is in tip-top condition and whether or not we need to do anything to improve your health. So I don't need anyone complaining, okay, about nonsense like the light is too bright. The light is too bright, it hurts my eyes. Boo-hoo. Boo-hoo, mother flipper. You know what I'm saying? Okay. Okay, good. Good job following that light. I've actually got a second light here, very similar, except this is more of a cold blue light. Okay, the colours do impact how your eyes behave. We're going to be doing avoid like the other tests that we've performed so far today. Okay. Did I say millimeter earlier? I meant nanometer. Okay. It's imperative that you keep your head absolutely perfectly still. Even the slightest change in angle or position of your head is unacceptable. Okay, so I hope you're following the light. Did you just move your head? You just moved your head, didn't you? Well, congratulations, because you've just rendered the results of that whole light trigger test useless. Okay, so unfortunately so far you're performing very badly on this cranial nerve exam. I'm beginning to think there's either something wrong with you, as in your cranial nerves damaged, or you have brain damage maybe. I'm not sure, because you can't seem to follow simple instructions or complete these tests. I'm not sure. Okay, we better do some further testing to make sure, to find out what is the cause of your problems today that we're having. Okay, having a bit of problems today, aren't we? It's not going particularly well, is it? No. Right. Were you this troublesome for Dr. Sheik? Were you this troublesome for Dr. Sheik, or is it just me? Is it a personal issue? You don't like me, is it? Yeah, whatever, no problem. I keep things professional because I'm a doctor. Okay, that's what I do. The next test we're going to do is the finger wiggle test. Okay. What I need you to do is I need you to keep your head still. Please keep your head still this time. Focus your eyes on my nose. I'm going to hold my fingers, different little locations, and I'm going to wiggle one of the fingers, maybe both, and I want you to tell me left, right, or both, whichever wiggles. Okay, so here we go, starting now. Good. 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 Okay, so you can at least perform that test correctly, but how about the peripheral vision test? For this one, I need you to once again focus your eyes on my nose, and I'm going to move my fingers in different directions like this, and I need you to tell me when you can no longer see the fingers. Okay, let's go. Starting now. Tell me when you can no longer see the fingers. Okay, that's good. Okay, very good. Very good. See. Very good. Okay, so you've done well in the last two tests. Now that's interesting. That's good, positive. And now I want to do the number of fingers test. Okay, similar to previous tests, I need you to keep focusing on my nose. Only look at my nose. This is mostly to observe how your peripheral vision is working. Okay, I'm going to hold up a number of fingers in the corners of your vision, and I need you to tell me how many fingers I'm holding up. Okay, quite simple, quite simple. Hopefully you can do this. Okay, let's begin. That's one. Very good. Yes. That's two. Very good. 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 those last 3 little tests, but I must say I'm very concerned about what I've seen in the tests prior. When I was looking at your eyes with the magnifying glass, they looked unusual to me. They didn't even look the same. Each eye looked different in terms of its physical appearance and in terms of its performance with regards to dilation, pupil dilation in particular. Okay, I also, obviously the eye chart test, we didn't really get any good positive results from that either. And I had to touch you around the eyes, didn't I? I remember, did I do that for you? I did try to do that, didn't I? But you're too small. That's right. And I just ended up sort of bonking you on the head, didn't I? Just a little bonk, bonk, bonk on the head. So that test also was not particularly good. What else? Yes, and of course the light triggers test. You performed badly. You moved your head when I told you not to. So that was inconclusive, I think we should say. So we do have some slightly negative results, some slightly concerning results. And I think what I need to do is I need to talk to Dr. Sheik, see if she could possibly perform some brain surgery on you. I think this is the only logical next conclusion to make. Okay, so I'll have a word with Dr. Sheik now, and hopefully she can come and remove your brain and examine the brain, maybe work on it, adjust a few things if necessary, and then of course put the brain back in your little head. Okay, put the little brain back in the little head. Okay, back in the little head. And then that should be the end of today's appointment, today's cranial nerve exam. So I probably won't be seeing you again now. I'm going to hand you over to Dr. Sheik for one last time. And yes, I hope you have enjoyed our time together today. Very nice to see you, even though you were a little bit of a troublemaker, weren't you? A little bit of a troublemaker. Didn't do the tests very well. But that's okay. I forgive you. I forgive you. Okay. Good to see you. Take care. And I'm sure you'll be in good hands with Dr. Sheik removing your brain now. Okay. Toodaloo. Toodaloo.
Okay, so Dr. Jones and I have been discussing, and we really think that it might be best for us to do some brain surgery just to get into the nitty-gritty, and just find out what exactly is going on. Because frankly, it's not normal to fail every single one of these cranial nerve exam tests. So I'll just put this down over here. And I'll just get some gloves on just to make sure that everything is nice and hygienic. These gloves are a little bit big for me, I apologise. I have very small hands, so, and these are already small. You can see they're a little bit big. Okay, so I was thinking my usual tools won't work for someone as small as you, so I'm going to use these tweezers, because if I use scissors then your head might pop right off. It might pop right off, and who knows what else might happen. I might do a lot more damage than I intended, and I don't think normal surgical tools will help either. So yes, anesthesia. Okay, I don't think the normal anesthesia will work very well for you, because I might end up putting you to sleep for too long, so I'm just going to use this dropper. Okay, and just drop some of that liquid on your head. Okay, there you go. So hopefully that will numb any pain on your side, so let's just say it's a bit of an experiment. But if I give it a good quick clean, then I think it will do the job. This brush is really dirty. Okay, I think that's done. Just get a little bit of dust off your brain that I managed to put on earlier from the brush. Okay, so your brain is incredibly fascinating. Do you think I can keep a little morsel of your brain just for scientific purposes? No? That's a bit cheeky to ask, isn't it? Well, okay, let me put your brain back. Okay, it's very sticky, your brain. Very strange. Okay, I'll put your brain back and have your brain back. Okay, there you go. Okay, now hopefully that will do the trick. And you're good to go, you're good to go, you're good to go. So you might experience some very strange sensations, perhaps some tingly or numb sensations as the anesthesia wears off, but I promise you it won't last for too long. So that's it then. Thank you very much for coming to see Dr. Jones, and